Cahill and Acting Leader, I received a communication from Ms Stella O'Malley of GenSpect, an organisation that advocates for an evidence-based approach to gender distress, and they're concerned about Minister Roderick O'Gorman's recent announcement that he's going to bring forward conversion therapy legislation to Cabinet in June, but which includes gender identity and not only sexual orientation in its purview. And their particular concern is that this will put clinicians working with patients with gender identity issues in an impossible situation, that where they follow their training and professional standards to complete clinically appropriate assessments, to explore factors which may be contributing to a patient's gender dysphoria, and who proceed with caution before advocating for gender affirmation medication or surgery, that they might be at risk of accusations of conversion therapy and possible criminal prosecution. Not to mind, of course, those clinicians who accept and affirm a patient with gender dysphoria's declared gender identity, who don't explore any contraindications for fear of prosecution, and who might be at risk of legal action from patients who subsequently regret medical gender transition. Now, the remarkable thing is that the Minister commissioned publicly funded research from TCD School of Nursing and Midwifery, and GenSpect has exposed many flaws in that research, that it doesn't clearly define what would be included if gender identity is to be included in this legislation on conversion therapy. The fact that the evidence they relied on was 23 responses to an anonymous online survey and 2 interviews. No evidence of complaints from any professional bodies, clinical bodies, a failure to acknowledge disagreement among medical professionals in the area, and that the research was not independent, that activists from various organisations were appointed to assist and advise the TCD researchers. And they have listed other problems with the research as well. Now, I have 3 questions. Should properly researched or poorly researched and tendentious research like this carry a university label? And would the authorities in Trinity really be happy that it should? And what is the Minister, and I'll conclude with my question, and thank you, Cahill, what is the Minister for Children doing, using taxpayers' money to pay for research like this and to pay activists to assist it? And what is any Minister for Children doing, proposing legislation that would expose reputable clinicians to prosecution if they try to apply objective therapeutic standards to working with children with gender distress? I think the least we could do, Cahill, is ask the Minister for Children to come into this House and explain himself.
Thank you. This and Senator Tim Lombard.